Hi there, so this video is going to be going over clinical pelvimetry, what it is, and how to perform a pelvimetry exam. So pelvimetry is a very useful tool. While it's not something that's used often in midwifery because it can lead to unnecessary early interventions, it can be very useful in assessing the pelvis when the baby isn't coming to see if maybe that is playing a factor. And it can also be used as a good reassurance to the mother that their pelvis is adequate for the baby. So going to start, I have my pelvis here by inserting 2 fingers into the vagina like so. And you're going to feel the sacrum. You're feeling up and down and kind of side to side just to see if it is concave, which it usually is. If it's not concave, that can tell you a little bit about the shape itself. Then you're going to feel for the sacral promontory, which you can see is right up here. Typically in a normal gynecoid pelvis, you will not feel it. If you can feel it, you can measure the distance by knowing the length in centimeters between the inner notch of your thumb and the tip of your longest finger. For me, that's my middle finger. Some people it might not be. So the length of mine is 11.8 centimeters. So if I can feel it, that tells me that it's at least 11.8 centimeters. And if I can't feel it, then it's greater than 11.8 centimeters. Then you're going to trace the pelvic brim. This should be rounded and curved and not angled. Then you're going to pass your fingers down the side wall. You're going to feel if it's straight, convergent, or divergent. Then you'll feel for the ischial spine, such as right here. And that is that blunt and hard to find, or is it prominent or very prominent? And then you'll feel the sacral notch, which is right here. Right here is the pelvic notch. Or I'm sorry, the sacral notch. I keep getting that wrong. Is that narrow and deep, or is it wide and shallow? Then you're going to palpate the intraspinous diameter, which is the distance between the 2 ischial spines. And that's kind of hard for me to show actually doing it. So typically you will not feel both ischial spines at the same time, but what you're looking for is if you can. And then lastly, you are going to remove your fingers and make a fist. And you're going to use that fist to assess the diameter between the ischial tuberosities. Are they wide or are they narrow? So for me in this pelvis, my knuckles fit in it with a little bit extra room. My knuckles measured are 9 centimeters. So from this, I can conclude that the distance between the ischial tuberosities is greater than 9 centimeters. So yeah, that's kind of a quick, simplified overview of a pelvimetry exam. Again, it's not used super often, but it can be a very important tool for a midwife to have. So thank you for watching. Bye.